In the last couple of hours, the GMB has announced that nearly 1,500 ambulance workers across Yorkshire have voted in favour of strike action. Workers across the ambulance services and some NHS trusts have voted to strike over the government's imposed 4% pay award. Paramedics, emergency care assistants, call handlers and other staff are now set to walk out. Strike dates have yet to be set. Deanne Ferguson is from the GMB union. Good afternoon, Deanne.
Hi, good afternoon, Howie.
So take us through the reasons for this ballot in favour of strike action then.
So members have been facing for over a decade real terms pay cut and a worsening of their conditions, and they're absolutely on their knees and feel as though this is the only form of action that they're able to take to try and get the government around the table to listen to the concerns and the crisis within the NHS and to obviously discuss pay and conditions with a serious ear from the government.
So the government offering 4% already, you've rejected that. What are you asking for then?
So our members are asking for inflation or above, but it's more than that, Howie. So we are seeing the biggest crisis in our NHS already. So hospital handover times, A&E handover times from our paramedics are clocking up to 26 hours where there's a patient in the back of an ambulance waiting to be handed over. We've seen local government funding cuts and we're also seeing funding cuts towards the care service, which then means that more patients are spending longer within the hospitals, which then means when new patients are arriving, they are held within the back of the ambulance and in some examples treated in the back of the ambulances and even discharged from the back of an ambulance, spending hours and hours and hours. And that's not what the paramedics and our care workers signed up to do. They feel hugely demoralised, they feel downtrodden, they're on their knees, and they want this government to get around the table with a serious plan around the NHS. They want to be proud of the NHS again in which they work for, but they equally want to have a decent pay rise so that they can feed the families at the end of the week and not have to pick up additional shifts and overtime shifts when they should be having respite from a very stressful job that they're already doing at the minute. And unfortunately, that's not the case, Howie.
Do you think the government is likely to find that extra money? I mean, the economy's not in great shape at the moment, Deanne.
Yeah, so I mean, we believe that the money is already there. It has just recently in its budget earmarked more money for the NHS, but it didn't actually say where that money was going. And what we're saying is that money needs to go to the frontline workers and it needs to go to the services in which our communities and local government provided before the government stripped that funding back. So it is there, Howie. It just needs to be distributed in the right places.
Give us an idea of the strength of feeling of your members then. What were the numbers in the ballot? How big was the majority in favour of action?
So we had a 65% turnout to take industrial action and action short of strike. So those members that voted to take part in strike action was 86%, and those members that voted to take action short of strike was 95%. So almost 100% of members that did vote voted to take some form of action, which I think tells you the strength of feeling of these workers.
And just to be clear, this action is across lots of job roles, is it? Not just paramedics?
It is. So we cover lots of different job roles. There's around about 1,500 members across the service. There's also other unions that have been balloting their members as well. So this goes from your 111 calls, 999 call handlers, your fleet drivers, the people that prepare the ambulances and clean the ambulances, and then your frontline carers and paramedics as well.
Exact dates for walkouts haven't been set yet, but when could you be looking at as a possibility of starting strike action?
Yeah, so we're currently in meetings with our representatives of the workers at the moment. The first planned industrial potentially could be this side of Christmas. So we should have those dates towards the end of this week. And when we do have them, we will obviously share that with our membership and the community and the press as well. And we call on support from the community and the public. We all stood outside and clapped our NHS heroes, and we asked them to support us in trying to get the government sat round the table to listen to our concerns.
With any strike action, of course, it tends to be the public who really get caught up in the whole thing and are inconvenienced by this. There are perhaps many people listening having, scheduled hospital appointments in the future, needing ambulances to and from a hospital, not on an emergency basis, but just getting there. This is going to just target them, isn't it?
Yeah, I mean, I'd like your listeners to understand, and probably many of them will if they've experienced the service over the past few months. The service is already on its knees and in crisis, and patient safety is already at risk, Howie. What we are saying is the government can intervene now before any industrial action is taken, and we urge upon public support in order to get the government around that table. But we will be there to provide life and limb cover, and we will be working with the Trust very closely to ensure that emergency cover is provided to the most vulnerable in our communities.
Deanne, many thanks for your time. Deanne Ferguson then from the GMB union. What about that? What do you think about the whole thing then? The actual strength of feeling within ambulance service and all the other jobs that, of course, are all in there as well as far as the NHS is concerned. The strength of feeling so much that they're having to go out on strike. What's your feeling on the whole thing? You can let me know on 0800 111 49 49. Text Sheffield to 81333. Start your text with Sheffield.